Good afternoon. Thank you very much for waiting. Apologize for the delay here this afternoon. Before I begin my remarks, I do want to say a few things about one, the federal response to the Hurricane Helene. I want to reassure all our Americans, all of the impacted areas from Hurricane Helene, that the full resources under my administration, the full resources of the federal government would be mobilized and put in place, and FEMA would be on location rendering aid. I've been in contact with the governors of the affected areas and have offered the full resources of the federal government under my administration. That would definitely be something we would do. As far as the longshoreman strike that's going to happen this evening if agreement is not reached, let me first say that I am in favor of collective bargaining. I am in favor of unions. They do a lot for our country, but this strike itself would have a big impact on our nation's economy. So if that were to take place under my administration, I would invoke the Taft-Hartley Act. That basically puts a 80-day cooling off period into place and try to work a resolution to this strike, because this strike has the potential to impact our economy a great deal. But I do want to welcome everyone here to the beautiful Rose Garden here this afternoon. I'm grateful to share with you all as we take another important step in building a stronger, more compassionate country. This afternoon, I want to address an issue that impacts every American, from families in small towns to those in our largest cities. The future of healthcare in this nation, our healthcare system, has long been a source of stress and uncertainty for far too many, and it's time for that to change. This afternoon, I'm proud to announce that today we are launching a bold new initiative to ensure healthcare is affordable and accessible for every citizen. This plan is about making sure that no one has to worry about going bankrupt from a hospital visit or losing their coverage when they need it the most. It's about making sure that prescription drugs are affordable and that every American can see a doctor when they're sick, no matter where they live or how much money they make. This is a crucial moment for our country. The decisions we make here today will shape the future of our healthcare system for generations to come. Our reform plan will not only provide coverage, but also prioritize prevention, lower cost, and give families the peace of mind they deserve. I want to take a moment here this afternoon to thank all the individuals who have helped make this initiative possible. They're all here today, and I want to thank you very much for your hard work and dedication to this. From the healthcare workers to on the front lines, to the members of Congress who have worked across the aisle to make this vision a reality. And it's been a lot of work, my friends. The task ahead will not be easy, but it's necessary. Together, we can create a healthcare system that works for everyone, not just those at the top. I look forward to continuing this work with all of you and to make sure every American has the care and dignity they deserve. And I really honestly believe that. We can do this. I've heard so many stories. You've heard me talk about education over the past 4 years, and I talk about her a lot. There's a teacher back home in Texas who had to get a prescription. It wasn't something that she wanted. It's something that she needed, and she had to pay $700 for a prescription. How is that fair? How is that fair for a person? And we all know where teacher pay is, and we're going to work our best to get that increased. But she simply couldn't afford it. That shouldn't be a choice like that. You shouldn't be forced into that situation. So, with Healthcare Plus, we're going to do what we can. We're going to get this passed through Congress. But with Healthcare Plus, every American in this country, every American, will have the access to affordable healthcare, affordable insurance, and all the medicines they need. You know, I just saw it this morning when I woke up. There's this ad on TV, and I won't say the name of the drug, but it talks about how this drug can be purchased. Well, it shows a comparison. of how it could cost $420 at a drugstore. But yet, through this service, you can get it for $35. $35. Why can't every single American in this country get every single drug that way? That's what we're going to do with Healthcare Plus. That's what we're going to do. And we will get it done. We'll get it passed through Congress. We'll work every avenue we can to get Healthcare Plus through and make it law. So thank you all very much. Thank you, thank you, thank you.